Welcome to the MD Edge Daily News for Wednesday, August 15th. I'm Nick Andrews.
And I'm Terry Rudd. Today, we explore the challenge of treating sleep disorders in chronic opioid users.
Also today, a next-generation sputum PCR panel boosts diagnostics for community-acquired pneumonia.
And later, more evidence that prenatal Tdap immunization doesn't boost a child's risk of autism spectrum disorder.
But we begin today with diet. New research shows that a diverse diet is not necessarily a healthy diet. This is according to an advisory issued by the American Heart Association, which emphasized the importance of a healthy eating pattern. The advisory was published last week in Circulation. In the report, researchers cite emerging evidence that greater dietary diversity may actually be associated with eating more poor-quality foods and higher energy intake. This was especially notable among middle-aged adults. The researchers conducted a literature search across dietary diversity studies from 2000 to 2017. They found that observational evidence does not support the idea that a more diverse diet is associated with healthy weight or an optimal eating pattern. However, they also note that many studies had significant limitations that contributed to high levels of inconsistency across all studies. Dr. Marcia Otto is a researcher with the University of Texas Health Sciences Center in Houston. She says the findings are consistent with evidence from feeding studies that show that exposure to foods with different characteristics led to increased energy intake. That energy intake may potentially explain a gain in waist circumference over time. The advisory committee says it is appropriate to promote a healthy eating pattern, and they emphasize plant foods, protein sources, low-fat dairy, vegetable oils, and nuts.
Given the prevalence of opioid use, doctors need to be alert to how opioid use affects sleep, and they need to understand the link between chronic opioid use and sleep disorders. That's according to comments at the annual meeting of the Associated Professional Sleep Societies in Baltimore. Dr. Bernardo Salim is a pulmonologist at the Mayo Clinic in Rochester, Minnesota. Dr. Salim presented a review of opioid-induced sleep disorders, including a small landmark study of 24 patients with chronic pain who used opioids. 46% of those patients had sleep-disordered breathing, and their risk rose with the morphine equivalent dose they were taking. Dr. Salim notes that opioids reduce respiration rate more than tidal volume, and they cause changes to respiratory rhythm. Opioids decrease hypercapnia, but increase hypoxic ventilatory response, and they decrease the arousal index. They also decrease upper airway muscle tone, and they act on chest and abdominal wall compliance. Click on the link in the podcast description to find out more about how opioids impact sleep.
A next-generation PCR film array panel identified etiologic pathogens in 100% of patients hospitalized for community-acquired pneumonia. This is according to a report by Dr. Catherine Hendrickson at the annual meeting of the American College of Physicians in New Orleans. Dr. Hendrickson is an internal medicine resident at Providence Portland Medical Center in Portland, Oregon. She says that rapid detection leads to less empiric antibiotic used in hospitalized patients. She also notes that if approved by the FDA, this investigational sputum PCR panel will simplify the diagnostic bundle and improve antibiotic stewardship. In a prospective study, Dr. Hendrickson and her colleagues investigated 63 patients with community-acquired pneumonia. They compared standard bundle diagnostic tests and the new BioFire array panel. Any community-acquired pneumonia pathogen was detected in every single patient using the new panel, with a mean number of pathogens identified of 2.5. The standard bundle detected a pathogen in 84% of patients, with half as many pathogens detected. You can find more data on the difference between the standard bundle panel and the BioFire panel by clicking the link in the description.
And finally today, a retrospective study of more than 80,000 children has found no increased risk of autism spectrum disorder associated with prenatal tetanus, diphtheria, and acellular pertussis immunization. The study researchers report that 1.6% of children born between 2011 and 2014 were diagnosed with autism spectrum disorder. The autism incidence rates were similar for children exposed to Tdap and those who weren't. 3.8 per 1,000 person years in the maternal Tdap vaccinated group versus 4.1 in the unvaccinated group. That means children of vaccinated mothers were 15% less likely to be diagnosed with autism spectrum disorder. Dr. Tracy Becerra-Kulke is a researcher in the Department of Research and Evaluation at Kaiser Permanente, Southern California. She says it's the first study to look at the risk of autism spectrum disorder after maternal exposure to the Tdap vaccine. She adds that the data potentially indicate that the maternal Tdap vaccine affects immune trajectories, protecting infants against infections that would otherwise lead to neurodevelopmental alterations. In the study, immunization rates with the prenatal Tdap vaccine ranged from 26% of the 2012 birth cohort to 79% of the 2014 birth cohort. And that concludes the MD Edge Daily News for Wednesday, August 15th. You can find links to these stories in the podcast description. For MD Edge, I'm Terry Rudd.
And I'm Nick Andrews. The MD Edge SciCast is all new today. Dr. Laura Marsh returns this week for a discussion on Parkinson's disease. And Dr. RK continues her talk on HIPAA. The SciCast comes out every Wednesday morning. You can subscribe to the SciCast, the Daily News, and all of our podcasts at MD Edge on Apple Podcasts, Google Podcasts, Spotify, and Alexa.